When it comes to opioid overdose, you need to know 3 things. Number 1, the signs and symptoms of an overdose. Number 2, make the call, save the life. Number 3, carry naloxone to save a life. The opioid overdose crisis, a consequence of the misuse of and addiction to opioids, is a serious national crisis. The term opioid addiction refers to addiction to the class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl and carfentanil, which can be lethal in very small doses, and pain relievers available legally by prescription such as OxyContin, Vicodin, codeine, and morphine. In the year 2017, the U.S. had more than 47,000 opioid overdose deaths and 1.7 million people with prescribed opioid substance use disorder. You may think that this crisis will not affect you because you don't know any illegal drug users. But think about these statistics. About 80% of people who use heroin first misused prescription opioids. 21 to 29% of patients prescribed opioids for chronic pain misuse them. And 8 to 12% of those patients develop an opioid use disorder. According to the 2019 Monitoring the Future survey data, nationally 2.3% of high school seniors misused OxyContin in the past year. So a person who is overdosing might fit the picture you have in your head of a heroin user. But that person could also be a teenager who started experimenting with the family medicine cabinet. Or it could be a commuter on a train in a business suit who was first prescribed a pain reliever for oral surgery or even a pickup basketball injury. In other words, someone overdosing from opioids could be someone anyone knows. Everyone needs to know the signs and symptoms of an overdose. They include pinpoint pupils, acting drunk, choking or gurgling sounds, slow, shallow, or no breathing, unconsciousness, blue lips or fingers, nausea or vomiting, cold, clammy or pale skin, marked confusion, delirium, disorientation or confusion, extreme sleepiness, seizures, convulsions, tremors. If you see someone who shows any of these signs and symptoms, make the call, save a life. Call 911 immediately. The Rhode Island Good Samaritan law protects you for helping save a life. The Good Samaritan Act provides immunity against charges for drug possession and operation crimes for an individual who calls for medical assistance when someone is experiencing an overdose. So don't be afraid to call to save a life, even if you were engaged in illegal drug use with that person. Also know that there is an antidote to opioid overdose. Naloxone is a medication that rapidly reverses opioid overdose and does not cause other harm to the person. Naloxone is available in a nasal spray or injection. You can do a free online training module and request to have a free dose of naloxone mailed to you without a prescription from the Community First Responders Program at the University of Rhode Island. Carry it on you so that you could save a life. Visit their website for more information at web.uri.edu/CFRP.